This is NDTV. And you're watching NDTV 24/7.
Hello and welcome to our special show where we answer your questions on the coronavirus. We look at the big medical breakthroughs and the latest news on India's battle against the pandemic. Well, India has registered its biggest spike yet in the new cases of coronavirus. 1540 cases reported in the last 24 hours, which has taken India's total to over 17,600. Now, India's mortality rate is 3.2%, but there are some states that are better off than others. And let's just take a quick look at the comparison of the best and worst states also, if we can get that graphic up on our screens. Now, this is a comparison of states which have over 100 cases. Punjab doesn't have as many cases and deaths, but its mortality is among the highest. It's 7.3%. Maharashtra has the maximum number of cases in terms of an absolute number, but its mortality rate is lower than that of Punjab's at 5.3%. The India average, as we said, 3.1%. Delhi has an even lower mortality rate of 2.2%. Gujarat of 3.6%. But another good indicator to look at is what is known as the doubling rate. Now, that's the number of days it takes for a state, for cases to double in a state. Delhi now has one of the higher, has a doubling rate of 8.5 days, which means that the number of cases in Delhi double only after 8.5 days. Karnataka has managed to, in fact, postpone its doubling rate even further. It takes 9 days for the number of cases to double in Karnataka. But perhaps the most worrying state is Gujarat, where cases are doubling in just 3.7 days. And what appears to be encouraging news from Delhi, a 49-year-old man who had tested positive for the coronavirus on the 4th of April, along with his parents, has now recovered after being given the newly introduced plasma therapy. Now, if we can get the news graphic of that up, doctors have cautioned that blood plasma therapy is not a magic bullet and that during the patient's treatment, other standard treatment protocols were also followed. Doctors say plasma therapy could have worked as a catalyst in speeding up recovery of the patient. Well, we'll talk about all this and much more with our medical experts on the show this morning, Dr. Prasun Deb, endocrinologist with the KIMS Hospital in Hyderabad, Telangana, joining us this morning. We also have Dr. Rajpal Abhaichand, cardio-interventional cardiologist of the GKNM Hospital in Coimbatore. He's also Director of Cardiovascular Research and Innovation. Dr. Abhaichand, if I can begin with you, tell us a little more, if you will, about this plasma therapy that we've been talking about for some time, and now this case of a patient in Delhi. Doctors say that he was given this new plasma therapy, and while other standard treatment protocols were also followed, this may have worked as a catalyst. What more do we know about plasma therapy and how it can help?
Actually, good morning. This plasma therapy, I believe, is something like an adjunct. I don't think we have enough data to clearly say that whether this will definitely benefit or no. And it would be too early to make a definitive statement on this.
Right.
And we need to follow up these patients. Yes, there have been anecdotal evidence of miraculous cures, but we are far away from saying that it's a standard therapy.
Dr. Deb, anything you'd like to add to that? There is, of course, the caveat that his father, who was also given the same treatment but was also brought in a far more severe condition, actually passed away. So there are obviously indications there as well that it's not, as the doctors themselves have said, any kind of a magic bullet. But is this something that can help?
Good morning, viewers, and thanks, Ankita, for having me on the show. I agree that at this point of time, as Dr. Abhaichand said, that the plasma therapy is at best an adjunct therapy, because what happens is a person who has recovered from the infection has obviously developed antibodies which has been able to defeat the disease. Now, if you take the plasma from this person, you will have antibodies which have already killed the organism. And theoretically, that actually, works somewhat like a vaccine and sort of helps the patient to overcome the disease. However, it is far too early to make this a standard therapy for all patients. And as you have pointed out, patients' response will not be the same right across. And so this will be one of the things that the doctors will give along with the other standard of care therapy.
Right. Let's also talk about the doubling rate, if we can, doctors. The fact that cases in Delhi, for instance, are taking 8.5 days to double. Gujarat, however, seems to have just 3 days, is seeing cases doubling in just 3.5 days or so. What would account for this difference between states? If Dr. Abhaichand would like to take that.
This would be a very difficult question to answer, but I think it's also a reflection of the strictness with which lockdown procedures have been adhered to. And it would also mean the number of migrant workers. We heard that in Delhi, parts of Delhi, there were a lot of migrant workers who were struggling to leave and they were all conglomerated in one place. So that could increase the lockdown. Also, it is also a reflection of how people personally, at their own level, look at prevention, social distancing, adhering to the norms, wearing masks. These are all things which really matter. And I think the doubling time has been there in some states. Like, for example, Kerala, it's 72 days. How well they have managed their situation, I think, is largely a reflection of how the people and the local government have done their bit.
All right, let's take our first caller now. GS Chawla is calling us from Ludhiana this morning. GS Chawla, go ahead with your question.
Yes, ma'am, my question is there any possibility of transmission of coronavirus from dead body of corona victims?
All right, Mr. Chawla, thank you for your question. And in fact, that is one of the stories we're flagging today from Chennai, where a doctor, in fact, who contracted coronavirus and died, was denied a burial in at least 2 different cemeteries. It's a tragic story today of how a mob attacked his hearse, injuring the driver. His colleagues then had to take his body away and literally give him a burial in a small spot by themselves. It's tragic that health workers should suffer a fate like this in death, but it's a relevant question. How infectious are bodies of people who have died from the coronavirus? Why is there so much panic about funerals? Dr. Deb, if you'd like to take that question.
Yes, that's a valid question. And the answer is that yes, there is a possibility that the dead body would be transmitting the infection to people who handled it carelessly. Just like any other fomites, that is, a fomite is an inanimate object on which the virus can stay for a period of time and infect the next person who touches it. The same would apply to a dead body as well. Now, while a living person would be more infectious because the person is still breathing and can actually theoretically pass on droplet infection to other people, the dead body still nevertheless remains infective, and so they have to be handled very carefully. And the correct protocol, I'm sure, is being maintained in all hospitals in the proper disposal of infected dead bodies. What is not acceptable is the kind of response that we are seeing among people. This panic mode is not going to help anyone, and I'm sure you are going to take that up in your news item later on.
Absolutely. And in fact, what we are seeing on our screens now are visuals of that ambulance that was carrying the doctor's body that was attacked. You can see the windows broken. The driver was injured. Corporation officials who were there to ensure that the burial took place following all precautions were also injured. And it was literally then left up to this man, this doctor's colleagues, to ensure some kind of a burial for him. Dr. Abhaichand, anything you'd like to add to this? Just a message to all our viewers who are watching this show. Yes, there may be cause for concern of infection from a dead body, but presumably there are authorities who are also ensuring that due protocol is followed. So why should there be reactions like this?
Yes.
I think this stems from public fear, lack of knowledge, and it's amazing. I mean, it's deeply hurting that this is happening. Imagine if health workers are treated like this, then to whom will you go to when you have a problem? I think public should understand that this could happen to anybody. It's not to a doctor. It could happen to anybody, and it is best to treat the bodies with respect. And if you harm your own health workers, who is going to stand in the hospital? Who will be treating patients if this is the response from the public?
All right. Pankaj is calling us from Mumbai at this point. Pankaj, go ahead with your question.
Yes, good morning.
Good
The WHO has stated recently that the worst is yet to come. The question is herd immunity the solution? And if it is so, what will be the mortality rate in India? The second question is...
No,
is it
can we
social
just restrict
distancing?
that to one question so that we can take more callers? Pankaj, I think we'll restrict that to just that one question. We'll have the doctors answer that. Dr. Deb? We heard from the WHO chief saying the worst is still ahead. What do you think that means? And is this a warning just for countries where restrictions are now being lifted? Or is this something that all of us, even those who are still in lockdown and a very stringent lockdown at that, should take very careful heed of?
Yes, this is obviously a difficult question to answer because we are talking about too many variables here. You cannot obviously compare a country like India, which was very early in its lockdown, to a country like, for example, the United States, which is all in the news for all the wrong reasons at this point of time. So the prediction for different populations would obviously be different depending on what their lockdown status, their innate herd immunity is. And so you cannot have a single prediction which is applicable to everyone. However, the thing that all of us need to remember is that after this mandatory lockdown period, which ends probably in the first week of May, it is not going to be business as usual for all of us. Because what we are achieving with this lockdown is that we are slowing down the transmission rate, flattening the curve, so to speak, but the virus is not going to go away. And so the basic rules of social distancing and hand washing is something that you will now have to do for the rest of your life. This is not going to go away. And so for the next 6 months, 1 year, there would be people who would be subsequently infected, and this in the long run is going to help in what is called the herd immunity. You see, once the partial lockdown relaxations occur, the healthier people, the healthier part of the population are probably going to go out and they will be exposed to the infection. For 80% of you, you will not even notice that you have been infected, and this will give rise to the immunity in the overall population, and that is what is herd immunity is all about. Now, how long this will take, what will be the trajectory, is obviously something that statisticians are the best people to answer. We doctors hardly are very good at maths, so I don't think we should be even trying to answer that. But it's not going to go away. It's not as if a magic switch will be thrown on the 7th of May and everything is going to clear off because the lockdown is over. So we all have to be careful. The numbers are going to rise, although we have done a very good job till now about in containing the rise of the numbers. But it's not going to go away. Absolutely.
Right. Yes, that's very important to note. We have another caller. Natarajan is on the phone line with us from Chennai. Natarajan, go ahead with your question.
Good morning, doctor. You know that the sinuses and eosinophils both are interlinked together. A person who is having high eosinophils always will be having the same indications like the corona indication. How we differentiate? And the other thing is, a person whoever is affected with the corona...
Again, Natarajan, I'd like you to restrict yourself to one question only so that we can take more callers. Thank you very much for your first question. We'll have the doctors answer that. Dr. Abhaichand, I think his question is, he has a sinus condition already. How does he distinguish between his existing sinus condition and whether at all he has symptoms of coronavirus?
Yeah, this is a very important question, Mr. Natarajan, how to distinguish an upper respiratory. It is like what you have is something in the nose, sinuses, and up to the throat. So usually the coronavirus affects the lungs and the lower respiratory tract. What we mean by lower respiratory tract is when it affects the lungs and the bronchi and you have cough and sputum production. Usually, the coronavirus does not affect the sinuses and it does not cause a transient cough. The cough that you would have due to a coronavirus infection versus allergic sinus or a sinus problem is that the coronavirus infection would be a persistent cough. There may be some sputum production, there may be some fever, but if you have a sinus problem, remember it's the upper respiratory tract, the nose, the sinuses. Coronavirus affects this very, very less commonly compared to the actual affliction of the lungs.
All right.
If I may.
Yes, Dr. Deb, you had something to add?
Just one small thing. Since you have a condition which you have already been afflicted with, anything that is not normal for you should be investigated. So
Right.
if you have flu-like symptoms, if you have developed a fever which you did not have, if you cannot smell things, anosmia has been shown as one of the earlier symptoms of this infection. So anything that you think is out of the common, you probably need to get yourself tested.
I think that's very wise advice indeed. Bhaskar Rao is calling us from Visakhapatnam. Bhaskar, go ahead with your question.
Good morning, everybody. My question is, once the affected person is relieved from coronavirus, will he be guaranteed to the rest of his life to have a normal life and he will have a rejuvenation in his body? Or is a threat that he might be susceptible to any disease?
All right. So you're asking whether you can continue to have other health issues, whether there'll be a debilitating effect once you've contracted this virus, I think. Dr. Deb, if you'd like to take that, does it have any lasting effects?
Yeah, fair question. Just like any other viral infection, once the infection is over, most people can actually go back to their normal life subsequently. There are some sort of lasting effects of a viral infection, sometimes related to the heart or the chest. But for most people, once the infection is over, yes, they can go back to their normal life. However, you'll have to understand this is just one strain of one virus which has affected you. In fact, there are now disturbing reports from some countries that people who have been infected and then they were cured, they have had a relapse. Now, whether they have had a relapse of the same virus or a slightly different strain of the same family, doctors are not very sure. So what I am trying to say is that this particular infection, once you are treated of it, is very unlikely to cause any lasting effects. But then you are as susceptible as anyone else to have a reinfection. Your immune system will remain a little weak for some period of time, and you can get secondary bacterial infections which are not virus at all. And so you need to be a little careful for the next maybe 6 to 8 weeks.
Dr. Abhaichand, specifically because you're a very senior cardiologist, is there anything that you'd like to say at this point to those who have a cardiac condition, a heart condition? Is there anything specifically that they need to be careful of if indeed they do contract the virus and are then sort of moving on with their lives? Is there anything that they need to sort of keep in mind?
Yes. One thing that we have been seeing is people with the coronavirus, people who are so afraid of this coronavirus are not seeking medical attention for their chest pains early enough. Like say somebody with a heart attack, he's so scared to the hospital, and sometimes these chest pains may not be severe, but he continues to have the chest pain and he reaches the hospital very, very late. So this is something that the public must realize, that if one is having a heart attack, you still need to seek medical attention and do it very, very quickly. So when we had a patient recently who reached the hospital so late that his heart was damaged and there was nothing much we could do to help him. In the non-coronavirus time, this patient would have reached the hospital within maybe a few hours, but he dallied and wanted to avoid and reached very late, by which time things were not in a good position. That is one. The second thing is, you must realize, please continue to take your medication. There is a thought that, some medicines are some BP medicines, some heart medicines are not good in the coronavirus setting. That was a thought initially, but all bodies and societies have said that you can continue to take these drugs, and these drugs are called the ACE inhibitors or ARBs, and in fact, they may protect the lungs. So please continue your medication, continue to do your exercise at home, whatever is possible. There are various ways of doing it. And it's very important that you must protect yourself, because heart patients are not susceptible to increased infections. But once a patient with a cardiac problem gets an infection, then the severity of that infection may be much more vis-a-vis a normal patient. So this is something that we need to remember. We need to stay safe, take medication, and call a doctor. Advise a video call, speak to him on the phone, get onto the hospital on the phone, and speak to them if you have a problem.
And Dr. Deb, anything you'd like to add to that, specifically for those who are suffering from other underlying conditions, including diabetes?
Absolutely. As the doctor says, continue your medications. Please do not take your advice from WhatsApp. It might be a very good idea to switch off your WhatsApp in this period of time. And keeping track of how many patients got positive in the 24 hours. This is not a cricket score. Just stay off. It does not matter. I'm sure the specialists are at it. They are doing a very good job. You do not need to, lose your cool on this. Stay happy. Happiness is a very important thing. And exercise. Please exercise. The lockdown cannot be an excuse for not exercising, and walking to your fridge is not exercise.
That's very good advice. I think that's something that all of us need to take to heart. Yeah. I'm going to take one last caller. Raghu is calling us from Hyderabad. Raghu, go ahead.
Yeah, good morning, everybody.
Yes, good morning. Go ahead with your question.
Yeah, my question is regarding doubling rate. Is it not a misleading number? States which conduct higher number of tests will have faster rates compared to the states that conduct lower number of tests?
All right, whoever would like to take that. Is it also for lay people? Is it necessarily something that they need to look at or worry about? Presumably, this is far more at the epidemiological level and the level of sort of government and health authorities to determine what's happening where. But sure, go ahead. Dr. Deb, if you'd like to answer that.
Yeah, just in short, don't look at these numbers. As I told you, this is not a cricket score. As you say, the states who are testing more are going to pick up more cases. And the doubling rate also can be misleadingly high for a state which had very small numbers to start with.
Right.
Now, if you have 10 patients and you have discovered 10 more, then the doubling rate is 1 day. In the next day, it has doubled. But if you have had 1,000 cases, to have the next 1,000 cases will obviously take longer. And so the doubling rate is not a catch-all kind of a parameter. Do not go by these numbers and stop looking at these numbers. People who should be looking at it are looking at it. From your point of view, just stay home, stay safe, and stay happy.
All right, we'll leave it to that. Thanks very much indeed. Yes, Dr. Abhaichand, if you had a last word or comment to make.
My message to the public would be, please pay attention to the simple things. In life, as in everything else, it's very important that the simple things are what are going to take you long. Hand washing, social distancing, using masks. This is what will really help. If you have a serious cardiac problem, do not hesitate to reach out to a hospital. And do not get depressed. Loneliness is important. Talk to your friends on social media. Use the phone. Keep in touch with people. Don't get depressed and don't get lonely. Stay safe. We are all with you. And believe me, we will win this war against the coronavirus.
A very important message indeed. Thank you very much indeed, both Dr. Abhaichand and Dr. Deb, for being calm and reassuring voices on the show and underlying what really is needed at this point. Thank you very much indeed. Thanks for watching. Stay tuned for the latest headlines coming up in just a moment.